everybody, I'm Claudia Morandi, and I am the founder of the Don't Punish Pain Rally organization and also the Doctor-Patient Forum. I usually do these live feeds in my car because at home it's a little chaotic. So the reason I'm doing this YouTube video, and if you're finding this video, you know who I am because of the rallies, and probably you're a pain patient who has been cut off of your medication, or you're a doctor who has been targeted by the DEA, the DOJ, your state's medical board, or you have a loved one who's suffering and can no longer get medication. And I want to tell you why this is happening. This is very, very detailed, and there's a lot of ingredients that have gone into this horrible recipe, which we refer to as the pain patient genocide. This goes back to 2005. There's a man, I use that term loosely, his name's Andrew Kolodny. He's a psychiatrist, and I believe Kolodny, this originally started for him as a cause, where he wanted to slow down the overdosing or prevent the overdosing. What Andrew Kolodny did, and he's out of Brandeis University, so you got to remember these names because there's a lot of names. Andrew Kolodny, 2005, worked for the New York Department of Health, he was in the sector working, and he started to push Suboxone to be used for addicts instead of methadone. And eventually he and some other anti-opioid crusaders, they would create what's known as PROP, P-R-O-P. These are all anti-opioid crusaders. Maybe they lost a kid to an overdose, and what started off as a tool to help addicts just catapulted into the pain patient death movement, the pain patient genocide. Eventually, Kolodny would team up with other anti-opioid crusaders, Roger Chow, who conducted studies. He received $500,000 to have these studies, and his goal was to prove that opioids don't work long-term. Well, he failed miserably with those studies, and it wasn't even considered to be a long-term study. Now, once you have Prop teamed up with Shatterproof. They lost their kid to an overdose. He's got millions, Gary Mendel. And then they teamed up with Judy Rumler. She lost her kid to suicide and overdose, one or the other. And they teamed up with Farmed Out. And then they decided to just strictly focus on the reason we're having an overdosing crisis is because of prescription pain medication. So they were all successful in buying, and that's what they did. They bought the CDC, and the CDC had some of these morons, and they decided to create the 2016 CDC opioid prescribing guidelines, which have actually catapulted the overdose rate in our country. So, Shatterproof, Prop, Farmed Out, Fed Up. Basically, these people, the anti-opioid crusaders who lost a kid or a loved one to an overdose, they have focused on inflicting pain on people who take pain medication responsibly, and they've been very effective. They chirped into the ears of senators, governors, one being Chris Christie, that pig from New Jersey. And then they started to get in the ears of Indivior, who makes Suboxone, Pacera, who makes Exparel, a local anesthetic. And their mission has now become, there's two medications that they only want to use two. If you're a chronic pain patient, you should only be allowed to get buprenorphine or Suboxone. Suboxone was never intended to be used long-term, by the way. It was supposed to be to get a person, an addict, over the hump. But they've had so much success pumping millions and millions of dollars into your state that now people have adopted these guidelines, or whatever the word is that the anti-opioid crusaders is, regulations in your state. And now your doctor will not prescribe because of what those anti-opioid crusaders, remember, Shatterproof, Judy Brumler, Farmed Out, Prop. They've had so much success in paying off your senators, Congress, they've paid off, that now the government, our country, is actually considering having only opioid-free surgeries. So C-sections, mastectomies, they go after women. They believe women, all women are addicts. Once they get pain medication post-op, all women are addicts. So I think it's disgusting, those women who sit on those boards of Shatterproof, Pacera. These are all names you can never forget, because these people are to blame for the pain patient genocide. Now, let's talk about you. Why are you suffering? Because your doctors are terrified to prescribe. Those 2016 CDC guidelines were created with the help of anti-opioid crusaders, whose only goal was for you to be able to receive buprenorphine, which is used for addiction, right? You either get buprenorphine or nothing. So the DEA, they had to get in on all the money that everybody else was making off of the illicit fentanyl overdosing crisis. We never had a prescription pain medication problem. Bear in mind, we're in 2020, we're in the middle of COVID, prescribing is at an all-time low, yet overdosing continues to soar. Why? We never had a pain pill problem. Opioids, narcotic analgesics, whatever the hell you want to call them. So, what do? You go to the doctor, your doctor is, if you're fortunate, you get a good doctor who's willing to prescribe, but nobody wants to prescribe greater than 90 morphine equivalent. That 90 morphine equivalent, that's some arbitrary number that the CDC came up with those anti-opioid crusaders who make millions of dollars off promoting buprenorphine, Suboxone, Exparel, which is made by Pacera. So this is a lot of information. You gotta pay attention, because this is all about money. Those anti-opioid crusaders, they don't care about addicts. All they care about is how much money they can make saying they care about addicts. It's all about pumping the opioid gravy train. You're suffering because your doctor is terrified to prescribe because they've watched their colleagues get shipped off to prison. These doctors, they're pain management physicians. Now, in my opinion, only one doctor should be treating your pain, and that's your primary care physician. That'll never happen until we eliminate these 2016 CDC guidelines. Only one person should be treating your pain, not some random anesthesiologist. But your family doctor, but the DEA targets. Now, let me explain to you how they target your doctor. If your another part of, another horrible organization is your state's medical board. In Rhode Island, it would be the Rhode Island Disciplinary Medical Board. And there's about, 12 people that sit on your medical board. What they do is they print out a list of the highest prescribers and they give that to the DEA. The DEA then targets your doctor, who's committed no crime. They raid your doctor's office, they seize your doctor's assets, and they take your doctor's DEA license away. Now, these are doctors, they're not lawyers, so they're afraid, they don't know what to do. And this is for you, doctors. Please don't call an attorney that makes up wills if this happens to you. You need to get an attorney that specializes in healthcare defense. And you can email me at any time and we'll give you a list of those attorneys. Now, once the DEA gets their hands on your doctor, they're going to terrorize him, his family, and by the time they're done, they'll put out a press release saying this doctor prescribed 700,000 pills. Well, guess what? Everybody needs to be the highest prescriber, because the government has only left us with a handful, maybe 10,000 doctors in the country who can prescribe. That's who the DEA feeds off of. They're another disgusting, venomous agency. Your doctor will more likely than not plead, and that means that they're going to say before a court, I'm guilty, because they don't want to go to prison like poor Joel Smithers, who's doing 40 years behind bars. Now, while there were some bad apples who were overprescribing, we've now been robbed of any chance to live a quality-filled life, and that's why you can't get pain medication. Let's go back to those anti-opioid crusaders. You know who else they work with? Your insurance carrier. So if you're in a state like perhaps Oregon, those anti-opioid crusaders, Prop, Shatterproof, Judy Rumler, everybody who lost a kid to an overdose, they decided, well, people with fibromyalgia and low back pain should never need pain medication. After all, I have back pain, they say. I don't take opioids, why should you? These aren't good people, as you can tell from what I've just spewed about all of these people. These people don't care about addiction. These people care only about how much money they can get from pharmaceutical companies, how much money pharmaceutical companies can pay doctors to promote these bullshit, nonsensical drugs, and how much money they can continue to funnel through their nonprofits, paying off your senators. So it looks like our problem has been funded by, you name it, Big Pharma, you call it, whatever it is. Big Pharma has been hosting the pain patient genocide, and everybody has made a lot of money. What can you do? Well, you can contact your senators and you'll probably get some nonsense bullshit form letter back in the mail. But this is a year where you need to vote, and you need to get that senator out of office. You may need to get your local representative out of office. Another thing that you can do is you can get some pain patient legislation sponsored in your state. When that's no easy feat. 3 years and I'm still trying in Rhode Island. But what we've done at the Don't Punish Pain Rally organization, by the way, I'm a volunteer, I don't make any money doing what I'm doing, is we've put this cause on the map. Now, I was born to fight. You may not be a fighter. I get that. Not everybody's made to fight. And doctors, my partner is Dr. Arnold Feldman, the Louisiana Medical Board, probably the most corrupt, disgusting medical board, they're holding his license hostage for $500,000. He never had a patient overdose. He was actually a very conservative prescriber. But medical boards, once again, they print out a list of the highest prescribers or doctors that they just don't like, because usually doctors rat out other doctors. Another crazy principle in my mind. I worked with lawyers. If you ever did that in my state, you would burn yourself a pair of cement shoes. But doctors are, they're not as honest as you were raised to believe they were. Okay, we rally again, and we are hosting this time around the 500 White Coat March. We stand united with our well-intentioned physicians. You must fight back. You must expose these scum of the earth, anti-opioid zealots, for who they are. You must expose Indivior, the makers of Suboxone. You must expose Pacera, who has that moron pig Chris Christie sitting on their board. Chris Christie, after he was booted out of governor's office, now serves on their board and pays off, he's a lobbyist, he pays off other people in Congress to pass legislation regarding opioid-free mastectomies. Does it get any more disgusting than that? So that's the reason you can't get your medication. Also, they have paid off CVS, Walgreens, and the list is endless. So that's why you can't get your script filled at the pharmacy, because these pharmacies are also afraid of losing their licenses. But corporate has already been paid off by, once again, Gary Mendel from Shatterproof, Rumler, Prop, farmed out, fed up. And I kind of feel bad for the people at Fed Up, because what these anti-opioid crusaders have done, specifically Andrew Kolodny, Roger Chow, and the other Anna Lemke, that beast, what they've done is they actually expose your grief. Now, if you lost a kid to an overdose, they expose your grief while they're pocketing all that money. None of that money's going back into addiction programs. Look, at the end of the day, people, you've been duped by the CDC, by the state's medical board, by all of these anti-opioid crusaders. But I have some good news. We're making traction, and I won't stop fighting, and you're not going to stop fighting. We will expose these scum of the earth for who they are. please support your 500 White Coat March, Don't Punish Pain rally on October 7th, and continuously work on pain patient legislation. Hound your local reps, take their seats away from them, run for office if you have to. Get that senator out of office. They're going to miss making all that money, but you know what? They don't care about the pain patient because they're still getting their pain medication. I can assure you they're still getting their medication. If you're a doctor and you watch this and you need my help, you can email me, cmirandi1@cox.net. You keep fighting, I'll keep fighting. Once again, I'm Claudia Mirandi, the founder of the Don't Punish Pain Rally, and we continue to fight for you. Have a great day.